Joining us. I am visiting here and I want to thank our hosts and folks for being here today. And I'm here with the Congresswoman and others because it's a very important deadline coming up in terms of open enrollment. And open enrollment is that period when people can sign up for the Affordable Care Act and sign up for quality, affordable health insurance through the marketplace. And so that's happening now, but the 15th is an important deadline because if you sign up by the 15th, then your coverage starts January 1st. So this week is a big push for us, and we're pushing hard, and Florida's a very important place. While Florida has made great progress in terms of the number of uninsured that it has reduced, there's still quite a few uninsured in Florida, which is part of why we're here today and why we're here to talk about it. And three important things we want to make sure folks know. The first is affordability, and that's the fact that in the marketplace today, most folks who are in the marketplace can find a plan for $75 or less a month in premiums with the financial assistance, the tax credits that occur. The second thing we want people to know is we work to make it easier and simpler to sign up. And that's including things like an ability to compare plans. The fact that you can go in and compare the cost of plans, either premiums or deductibles, and then you can actually search if there are doctors or drugs that are important to you to make sure you have that information. Also, we've made using mobile easier so you don't have to do that double click to make the screens wider so that you can see and just sign up through mobile. And you can do that through in-person assistance. The last issue is for anyone who wants actual assistance with a person. A lot of people want to do it online, but many people actually want to talk to somebody because it's an important decision, and for many people, their first time. And for those folks, you can use our 1-800 number. That's 1-800-318-2596. You can go to healthcare.gov, or you can go to cuidadodesalud.gov. And the other thing you can do if you want to find a place to come and see someone in person, you can go to localhealth.healthcare.gov if you want to meet with someone face-to-face. With that, I want to turn it over to the Congresswoman, who's been a terrific partner and supporter in this effort.
Well, thank you, Madam Secretary, and welcome back to the Tampa Bay area. I'm glad we have giving you a warm welcome here in Tampa.
And I'm very happy to have it after D.C. today.
You know, the Affordable Care Act has been a godsend for Florida families and businesses, and there's no better example than where we are right here today at this small business that where our health care navigators from the University of South Florida and that coalition made it easy. They came to the workplace and answered questions directly. And here with the deadline of December 15th, they are ready to come to your business or your home or where you are in school and talk to you directly and help you review the options. You know, over the past few years, we've reduced the uninsured rate in Florida from 23 million to 13 million. Think about the economic stability that has provided to families and businesses all across the state. Most of our neighbors still get their health insurance through their employer or Medicare. They've also been great beneficiaries because when someone takes personal responsibility and gets health insurance and takes care of themselves, that has taken a great burden of cost off businesses and people that already have insurance through their employer. And we want to make sure that that continues. So I'm going to turn it over to Mayra, who can tell her personal story of what it was like to have a navigator come right here to the business here in Tampa and help her get signed up.
Well, it was very easy for me to do it when the navigator came because since my schedule and my boss let me do it here at work, and she would take time with each other. And it was easier. She would explain how it works, all the benefits, everything. So we chose the one that fits us the most. And since we all had different needs, then we chose the one accordingly to every one of us. So I think it was very easier for me to do it that way instead of being someone on the phone or not understanding it completely. So it was good to have somebody interact with me directly to understand how it works.
Thank you. Thank you. And we have the navigator who helped here today, Maria, who is here with us as well. With that, happy to take any questions you all might have on today and our visit.
Secretary, that will happen if the elect president ends the Obamacare.
You know, today we're very focused on getting insurance for 2017, this upcoming year. And I think whether it is the president-elect or the Congress or the insurance companies who are providing this insurance, who say, if you sign up, make your payment, it is a contract. We think that the insurance for 17 is in a place where it is safe. People have said they don't want to disrupt coverage. I think it is important, though, to reflect that it's an important conversation going on about what would happen in terms of repealing the Affordable Care Act. And I think it's very important to focus on that, because I think that would have impact later, not for the people signing up now, but that's a very important impact. Just in Florida alone, there were 1.7 million Floridians who signed up and made plan selections last year through the marketplace. And the idea that they would all lose their insurance and the other kinds of changes that would come with repeal actually affect more people. In the United States, 150 million people have their insurance through their jobs. And for those people, it means benefits like you can keep your child up till 26. Or for you, it might mean that you can make sure if you switch jobs, your pre-existing conditions like asthma or cancer or diabetes won't keep you out of insurance. Or for someone else, it means no longer having annual limits or lifetime limits. I met a woman actually here in Florida who didn't get her chemotherapy treatment until the next year because before the Affordable Care Act, she had an annual limit. Those are just a few of the kinds of things that it's a very important thing. For 17, for what we're talking about now in open enrollment, the insurers have indicated it's a contract. Everyone's indicated that they believe that people signing up will be protected. But the longer term question is an important one.
And you know how I'd answer that too is consumers in Florida have spoken. I mean, with 1.7 million of our neighbors have already gone and taken personal responsibility and signed up for health insurance, I would think that politicians in Washington better be cognizant of those numbers. And again, most people still get their health insurance through their employer. And what the ACA and healthcare.gov and all these navigators and folks have been able to do by having that place to shop on the internet with the help of the navigators is it's kept the cost of employment-based health insurance down. We've kept the pressure on that. So I would think people don't want to throw health insurance into chaos in the coming year. That would be a detriment to our neighbors across the Tampa Bay area and in Florida and businesses. So I will just see what's to come.
Can I get both of your, reaction on the selection on price?
You know, I've worked with Congressman Price. He was the chair of the Budget Committee. I serve on the Budget Committee, and I'll look forward to working with him. There are some reforms in Medicare we all work together on. But if he's going to rip the rug out from under families by privatizing Medicare or taking it to seniors in skilled nursing homes or these small business owners that finally have the peace of mind and economic stability that health insurance provides, then he's going to have a battle on his hands.
Called the congressman when he was announced to congratulate him and also to let him know he's going to have the opportunity to work with the department where there are tens of thousands of great people who are civil servants who've served in many administrations, and they're quality, hard-working people. And the last thing I told the congressman was I want to give him any assistance I can in terms of making sure that there is a smooth transition if he is confirmed.
You think he'll do a good job?
You know, what I have done is our job right now is to make sure we do everything possible to make sure there's a smooth transition for the next administration on everything from healthcare to Zika to the National Institutes of Health, and that's what we're working hard to do, and that's why I reached out to the congressman as soon as he was announced to know I'm here to help at the other end of the line if there's something I can do.
Anyone over here? People are concerned that the premiums keep going up. What can you say about that?
You know, I think it's important to talk about premiums, and it relates to a point that the Congresswoman raised. When we think about premiums, I think thinking about all of our healthcare system. And so for those 150 million Americans, and most of the folks here in Florida, that have their health insurance through their job, in the last 6 years, we've seen 5 of the slowest years of premium growth on record. And while you don't want any growth at all, because growing cost isn't a great thing, we have seen a slowing of that growth. And so that's the vast majority of people. With regard to the conversation about premiums and rates, in terms of Medicare and Medicaid, the marketplace doesn't affect those. And so then you're left with the 11 million folks that are in the marketplace. And for those folks, one of the things that's very important, it's very important for people in the marketplace to know, is that about, in the nation, 85% of folks receive tax credits or the subsidy. And it was designed so that when prices move, your subsidy moves so you don't have a higher percentage of your income. So, and for the 15% who are seeing that, and they're seeing it in different places. A lot's been written about Arizona, which was an extreme situation with very high premium increases, which we don't support and think are bad things, and would like to see it be different. But across the nation, it has varied. And so there are varying levels. It depends on what state you're in, what happens. But for that 15%, those are the kinds of improvements we think we should make to the Affordable Care Act. Do things that actually reduce price and increase competition. And the President's spoken to a number of those things, and I'll give you one example. It has to do with high-cost drugs. And the belief that if you can create a situation where the Department of Health and Human Services could negotiate on high-cost or specialty drugs, we could have downward pressure that would help this overall cost.
Yeah, and let me add, let's get local here. We are very fortunate in the Tampa Bay area, and really most of Florida, to have a very competitive market, a lot of choices, and that's one reason the value of the navigators is so high here, because there are so many options. And in fact, I believe in this market, the average cost of a silver plan actually went down this year. Isn't that right?
It did, and we actually have 61 plans here in the Tampa Bay area.
61
We're
plans.
very fortunate.
So we've got to take that competition to other places, rather than say throw everything into chaos in people's economic future by saying we're going to do something with the ACA and Medicare. We've got to tackle those high drug costs and pharmaceutical costs. That would be a way to bring down co-payments and rates and frequency.
I think we've got time for one more. Let's do yours.
Do you anticipate, I'm an insurance agent, do you anticipate that after the 20th of January, when President-elect, people that are hesitant, like our community, Hispanics are very hesitant about the letters that they're getting. They're very confused, even though the plans has been lower because of the subsidy has been up, the confusion is amazing. I've been a pioneer with my agents since day one. We've been reaching out of the community through Florida, like you have no idea. And we have seen that people are not flowing like the first year, so people are still like waiting. What do you have to say about that? Do you anticipate they will extend because of the matter that after the 20 will be another 10, 11 days?
So open enrollment will go till the 31st. So it will go. So open enrollment will not end until January 31st. We won't be there. I will leave. When I leave on January 19th, I'll no longer be there. But the teams are in place, and probably more important than the teams in Washington, D.C. are folks here and folks like yourself and folks here on the ground who have the information, because that's what will afford people the opportunity. We want to encourage people to get in for this January 15th deadline, because if you get coverage, you really do want it for the whole year, in terms of thinking about your own economics and how to think about that you probably want the coverage for the full year. But it will go until January 31st. So even though there will be a change in administration on January 20th, open enrollment will continue to the end, and there are great career civil servants who are going to take care of making sure that the marketplace works, and we are depending on the fact that our successors will also do the execution and the day-to-day work that the American people expect to make things run.
Do you think Mr. Trump will end this legislation now?
You know, I just think we have to shift this conversation to a conversation that has been about rhetoric and slogans to the reality of what it means for real people on the ground. And I think when we start having that conversation, and that's part of why I'm here in Florida today, that's why we have consumers here, because the voice of the American people, that's what this is about. It's about what this means in their lives. And I think everyone, all of your viewers and all of you know that when there's a health issue for you or someone in your family, it's the most important thing that you face in terms of what that means. And so the benefits of the Affordable Care Act that have occurred because of this, I think, are very important to the American people. When you ask most folks, they don't say, I think if I have a pre-existing condition, I should be kept out. Or I think that my preventative services need to go back to a world where there are co-pays. And so I think that's where the conversation can and should turn, and will hopefully over the next month or two. But we'll be having that conversation. But I think we need to have it in the nation, not just in Washington, D.C.
All right, guys, that's all we have time for today.
Thank you. Thank you all.